Hello, future health advocates, and welcome to the Community Health Ambassador Program. I hope it has been a great experience for you all so far, and I'm thrilled to be part of this topic for the program. So I'll start with introducing myself. My name is Andrew. I am one of the health educators here at the Asian Pacific AIDS Intervention Team, also known as APAIT. So really our goal here at APAIT is to positively impact the quality of life for undeserved communities living with or at risk for HIV and AIDS and other health disparities with culturally competent and linguistically appropriate programs in Southern California. All right, so we'll be talking about HIV and COVID-19 education and awareness. So throughout this topic, I'll be going over fundamental information on HIV and how those living with HIV are affected or have been affected by COVID-19. All right, so here are some learning goals that we'll master by the end of this topic. So by the end of this course, we will know the definition of HIV and AIDS, and then we're going to know the different and similar symptoms of HIV, AIDS, and COVID-19. And then we're going to know the behaviors that put people at risk for HIV infection. Then after that, we're going to learn about different types of HIV testing and ways to prevent HIV. And once we have covered all of those components, we'll briefly talk about the risk factors of COVID-19 among those living with HIV. And this is where we'll learn about antiretroviral therapy and the importance of COVID-19 vaccinations. All right, so let's start with HIV and AIDS. All right, so what is HIV? The acronym HIV stands for Human Immunodeficiency Virus. So HIV infects the immune system, causing progressive damage and eventually making it unable to fight off infections. So basically what it does is that the virus attaches itself to immune system cells called CD4 lymphocyte cells, which protect the body against various bacteria, viruses, and other germs. So the CD4 cells are white blood cells that play an important role in our immune system, and it is an indication of the health of our immune system. So they are our body's natural defense system against pathogens, infections, and illnesses. And once attached, it enters the CD4 cells and uses it to make copies of itself. And then these copies then leave the CD4 cells, killing them in the process. Now, if HIV is left untreated, the HIV reduces the number of CD4 cells in the body, making the person more likely to get other infections of infection-related cancer. These are called opportunistic infections or cancer that take advantage of a very weak immune system and signal that the person has acquired immunodeficiency virus, also known as AIDS, which is the last stage of HIV infection. All right, so here we have the symptoms of HIV. They include fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers, which are, some of them are common symptoms of the COVID-19 virus. All right, now we're going to look at the different and similar symptoms of HIV and COVID-19. So on the left column here, we have symptoms of HIV. And then on the right column are common symptoms of COVID-19. Now they are quite similar, with the only difference being loss of taste or smell for COVID-19. So from this, we can't really rely on symptoms to tell if we have HIV or COVID-19. So the only way to know for sure is to get tested. All right, now that we covered the symptoms of HIV and COVID-19, we're going to look at the symptoms of AIDS. Now, if you recall from the first few slides, we mentioned that if HIV is left untreated, it can potentially lead to AIDS, which is the last stage of HIV infection. Now, the symptoms of AIDS vary from person to person, and these include rapid weight loss, recurring fever or profuse night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph glands in the armpits, groin or neck, long-lasting diarrhea, mouth, anus, or genital sores, pneumonia, blotches on skin, mouth, nose, or eyelids, memory loss, depression, and other neurologic disorders. Now, at this stage, the weakened immune system leads to an increasing number of severe illnesses, and those living with AIDS have a high viral load and can be very infectious. So now that we learned the foundation of HIV and AIDS, we're going to look at, so we're going to talk about the body fluids. There are 6 body fluids that do transmit HIV, and those include blood, breast milk, pre-cum, cum, vaginal, and anal secretions. Now, sweat, tears, saliva, and urine do not transmit HIV. Now, how might any of these fluids get inside a person's body? Well, we're going to talk about sexual modes of HIV transmission. Now, behaviors that poses no to low risk of transmission include kissing, mutual masturbation, and dry humping. Medium risks of transmission include unprotected oral sex. Now, if you are living with HIV, there is a higher risk of passing on HIV through someone performing oral sex on you if you are not taking treatment. And if you also have an untreated sexually transmitted infection. Now, if you don't have HIV and you are performing oral sex on someone who does have HIV, then you are at more risk of acquiring HIV if you have cuts, sores, or abrasions in your mouth or on your gums. There's also more risk if you have an infection in your throat or mouth. So regular dental routine checkups are very important for your healthy teeth and gums. Unprotected anal intercourse and unprotected vaginal course poses a high risk of HIV transmission. So to reduce risk of HIV, it's best to use condoms consistently and correctly, and to know your HIV status as well as your partner's. All right, now we're going to talk about non-sexual modes of HIV transmission. Now, blood is transferred through the use of shared, used, and unclean needles, and also through injected substances, including insulin, vitamins, hormones, steroids, drugs, and tattooing. Blood transfusion, US blood supply states as of May 1985, there were accounts of HIV being passed through blood transfusions before 1985. Now all blood for transfusion is screened for evidence of HIV. And then we have infected mother to fetus and or infant. Children can potentially be exposed to HIV when it passes from an HIV positive mother to the child. And this usually occurs during pregnancy, childbirth, or when breastfeeding. All right, so for the next couple of minutes, we'll briefly go over HIV testing and the types of tests. So through client interactions, there will be a risk assessment where we gather the client's information about their sexual experiences or any concerns that they may have. This is usually completed between 10 to 15 minutes. So once the blood samples have been collected, results typically take 1 to 2 weeks, to which they will be disclosed to the client. Now, some sites do offer rapid HIV testing that will allow results in about 20 minutes. So the HIV rapid test detects the body for HIV antibodies. So it is an antibody test. So antibodies are cells that fight off infection. So next, we have the window period. Now, when a person becomes infected with HIV, the body takes time to develop enough antibodies to show up on an HIV antibody test, which is the rapid test. Now, this period of time when people are infected with HIV, but may not have enough antibodies to show up on the test is called the window period. So following an infection, the human body can take anywhere from 2 weeks to 3 months to develop antibodies. So for example, let's say a person says the last time they got someone else's fluids into their body, which is their last possible exposure, happened on March 1st. So they come in to get tested on March 31st and results come back negative. They would have to return 3 months later, sometime in June, to get retested and close out that window period. Now, while a person is in the window period, they are advised to reduce their chances of opening up another window period. So during that time, they could use protection for every sexual encounter or throw away needles after every use. All right, so now we're going to move on to types of HIV testing. So there are 2 types of HIV testing. The first is confidential HIV testing. A person's personal information is collected and attached to results. So personal information can include name, ethnicity, city, and/or country of residence, and etc. They are given a receipt or card with their name on it to prove their HIV test results. And confidential testing is usually done in a clinical or a hospital setting. All right, next we have anonymous HIV testing. So a person's personal information is not attached to results, but will be provided with a unique unidentifiable code instead. They are not given a receipt with name to prove HIV test result, and these types of tests are mostly done at community-based organizations. All right, now we're going to talk about preventing HIV through medications. So the first we have is called PrEP. So pre-exposure prophylaxis, also known as PrEP, is intended for those who are HIV negative, so not living with HIV, and is used to prevent infection. It is a pill it is a 1 pill taken consistently every day, and it is fully effective for receptive anal sex after 7 days of daily use. For all other sex, PrEP reaches maximum protection at 20 days. And according to the CDC, prevention rate from sex is over 90%, but from injection, 70%. Now, there are some early side effects that do go away after the first month, and they include nausea, headaches, loss of appetite, and upset stomach. So those who wish to take PrEP are required to maintain regular doctor visits once a month. Prescription refill and HIV testing required every 3 months. And understand that PrEP does not protect against pregnancies nor any other STIs, as STIs are treated by antibiotics. All right, so the next one we have, the next HIV prevention method we have is PEP, which stands for post-exposure prophylaxis, meaning it taking medications after you may have been exposed to HIV to prevent becoming infected. So PEP must be started within 72 hours, so 3 days, after a potential exposure to HIV. And the sooner it is taken, the better. It is not a preventive measure, and it is sort of like the morning after pill. All right, risk factors and challenges. Now, if you recall in our earlier slides, we mentioned that a low CD4 count can potentially lead to other illnesses such as COVID-19, which can increase the chances of being hospitalized and developing severe symptoms. Now, most studies show that people with HIV who have underlying conditions, such as obesity, diabetes, or high blood pressure, COVID-19 have a higher risk of severe illness or death than other people with HIV. Now, social determinants of health. In many places, significant number of people with HIV are economically disadvantaged. They may lack education and resources. They may live in overcrowded housing, work in frontline jobs, or belong to ethnic minorities. They may experience reduced quality of care and loss of community support during the pandemic, and especially during the national lockdowns in 2020. So the COVID-19 pandemic raised challenges regarding HIV testing services and care for those who, for those newly diagnosed with HIV who require intensive care for physical and psychological health. During that time, the lack of in-person consultations for sexual health and follow-ups led people to become discouraged from seeking HIV testing and follow-up services. All right, antiretroviral therapy is a HIV treatment that reduces the amount of HIV in the body. Antiretroviral therapy can slow the progression of the HIV disease and delay the onset of AIDS. And those who do maintain this treatment go on to live long and healthy lives. This specific treatment suppresses the person's viral load. So undetectable equals untransmittable. So U equals U means that people with HIV who maintain an undetectable viral load by taking antiretroviral therapy daily as prescribed cannot sexually transmit the virus to others. And of course, consult medical provider on treatment plans. All right, recommended precautions for COVID-19. So according to the CDC, those living with HIV are recommended to partake in the same safety precautions against COVID-19. So proper hand washing, social distancing, avoid touching nose, mouth and eyes, and respiratory hygiene. So that could look like sneezing into the sleeve, using tissues and throwing them away. And also isolating from others and maintaining up-to-date vaccinations, especially COVID-19. And finally, the importance of COVID-19 vaccinations. So those living with HIV are considered the priority group for booster shots and during early stages of COVID-19 vaccinations, as they have compromised immune systems that could affect their health. In clinical trials and from extensive experience, COVID-19 vaccines were found to be safe and effective for those living with HIV. And currently there are no data to suggest that vaccines are not safe and effective for people with HIV. And that is all for this training. I hope it has been informative for you all. You're more than welcome to contact our office if you're interested in knowing more about our services, or if you're interested in HIV and STI testing as well. Again, my name is Andrew with APAIT, and I hope it has been a great experience for you all. All right, thank you. Take care.